welcome everybody. Thank you for coming. It's nice that there's some new faces here as well today. I think our general agenda today is that we're going to be talking about health related things, and we're going to have Andrea and Chewy from Ace talking about their wellbeing event last week. We're going to have Marsh from Lewisham talking about the week's worth of events that they've got coming up across a couple of London boroughs. Stephen is here from Skills for People, and they're going to be talking about their winter campaign. And then Kim was going to start us having a discussion around annual health checks. Does that sound okay with everybody?
Yeah.
Cool. And if anyone has any extra things that they want to jump in with or questions, please do. And I still don't think Marsh is here, but hopefully he will turn up before we get to him. So if I hand over to Andrea and Chewy, because you guys are here, is that all right?
Yeah, absolutely. Andrea was here. She's disappeared. So.
Oh, I was going to say, I'm sure I'd seen her.
Yeah, I've just messaged her. I don't know if her internet's dropped. So yeah, just see if she's. No, she must have dropped off somewhere. I don't know. Hopefully she'll come back. I mean, I can. Does anybody else want to go instead of us until Andrea gets back, and then? Or...
Stephen, do you want to go? Is that okay?
Yeah, that's absolutely fine. I may have to mute my dog shouts. It's my dog barking. Are you gonna let me? Can I share my screen? Do you need to do something?
Yeah, sure. I think you should just be able to.
Okay.
Let me know if you can.
I'll just start right. Hopefully, bear with me. Should work. Share screen. Can you see that?
Yeah, see it now. Yeah, see it. Yeah.
Okay. So I'm Stephen Thompson. I'm from Skills for People, which is self-advocacy is part of it, but does lots of things in Newcastle. And I was asked to come here to talk about a project called Get Well for Winter. Now, Rachel, how long have I got? I don't want to bore the pants off people.
Like 5 to 10 minutes.
Right. Okay.
Like we can squeeze in.
All right. So Get Well for, so basically we had a diabetes project going on where we were doing a diabetes course for people with learning disabilities, and it was very good, and you know it's going to have a lot of impact and all the rest of it. But then this disgusting, horrible virus came along, and I'm working on that project. So I've got type 2 myself, so it kind of was close to my heart for obvious reasons. And we couldn't run it in this virus. We couldn't get people together. I didn't want to do it online in case people had an emergency. So the group that were funding that said we could use the money for another project, which we've called Get Well for Winter. So if anybody doesn't understand what I'm saying, because I don't know you all, just shout, what? What does that mean? 25 years in this type of work and I still use jargon sometimes, so feel free to slap me down. So basically, Get Well for Winter is a 3.5-month project looking at how we can kind of, without lecturing people, just look at some general health issues for people with disabilities. And the reason why we're kind of keen on that is because you will all know that the death rates of people can be short. They can be higher than the rest of the population for many reasons. People can suffer from long-term conditions, and a long-term condition is things like type 2 diabetes. What else is a long-term condition? Heart disease, things that last a long time. But epilepsy. Yeah, okay, yeah, absolutely. And anybody can throw words in here. I ain't got a problem being, excellent. So, but what really stimulated this, if you like, was this coronavirus has had a massive impact on all of us, but it's had a real impact on people who are middle-aged and people who are overweight, and it's hit people with disabilities. So we were thinking, right, okay, if we could, so we're not, nobody's waving a magic wand, think we're all going to go run marathons or anything like that. That's not what this is about. It's about little kind of small steps. So Boris Johnson, he talked about people getting a little bit better for winter, and his target was like people can just lose 3 pounds, which is not a massive amount. So we kind of jumped on the back of that and said, what can we do? So we've come up with a project, and it's got 5 different kind of bits in it. I can play this video, which is probably less tedious than listening to me. It's about, well, it's not about, it is 5 minutes, 12 seconds long. Is that okay? Is that all right, Rachel? I'll play it. Yeah, so you're nodding, good stuff. So let's please play.
Hello, my name the North Eastern Cumbria Learning Disability Network.
Right, I'll do that again. Right, here we go.
Hello, my name is Judith Thompson. The North Eastern Cumbria Learning Disability Network and Skills for People invite you to get well for winter. So why is it important? Well, to enjoy life at its best, we need to be as fit, as well and as happy as we can be. We're all at risk of becoming unwell, catching cold or flu or even coronavirus, and especially in the winter, and especially for people with a learning disability. But one of the best ways of looking after ourselves is if we do something now and get well for winter. So what is it? Well, it's a brand new programme aimed at people with learning disability and autism, families, carers, support workers, friends, everyone. And it's from now, and it's going to lead right up until Christmas. Each week there'll be lots of information, ideas of what to eat, how to exercise, how to keep safe, how to feel good about yourself, and how to stay connected to other people. There'll be films to watch, recipes to make food, Zoom groups to join, opportunities to meet new people via Zoom and talk to friends. If we all commit to lose a bit of weight, move a bit more, know how to stay safe, keep in touch with people, have our flu jab, that will help us all get well for winter. So why not join us now? Thank you.
Hi, I'm Dawn Flockton and I'm getting well for winter. To go back to Slimming World on the 10th of September to get a little bit fitter and healthier, to lose some weight as well. And I'm doing 2 days of swimming to get healthier because I love me swimming. I missed it by lockdown. And I'm hoping the Special Olympics will be starting soon to get involved in me swimming and athletics. So I hope yous are getting well for winter as well. See you soon, bye.
Staying healthy for the winter, basically, it's like eating the right foods and not eating like the wrong stuff. You can eat fruit, go for nice long walks, and that's quite healthy, going for walks, plenty of water.
Hello, my name's Sally. I'm a new project worker at Skills for People. This year, I will be trying to get well for winter by using my bike more, and here it is.
For exercise, I could do on Wednesday, but also I tried doing walks from the block and to the shops and back as well.
Hiya, I'm Alison and I'm going to get well for winter. I'm going to eat lots of fresh vegetables and fruit and I'm going to lose some weight. Thank you. Bye.
Hello, my name is Stuart Chapel. I work at Skills for People. And to get well for winter, I will be trying to get out as much as possible rather than staying in the house.
Hi, my name's Emily, and for Get Well for Winter, I am going to try and eat more vegetables and choose healthier snacks.
Hello, I'm Stephen Thompson and I'm leading Get Well for Winter on behalf of Skills for People alongside the North Eastern Cumbria Learning Disability Network. Get Well for Winter for me is about a little bit about getting out and about as much as possible, but it's also about recognising the dark nights are going to come in. So like that I've stuck behind me here for this film. I do lots of daft pictures, which I started doing during lockdown. So So that's important for me. Yeah, you can see them all around this little room where I hide. So yeah, that's important for me. What I really hope is that a lot more people around the North East will get involved in this project, and it can be people with learning disabilities, people with autism, but also families, you know, and also support staff. You took your share of risks, you know, looking after people during this virus. You know, we never need to forget that. So anybody can get involved in this. So hopefully around and about me, I will be able to put numbers to contact. If you've got anything you want to share, if you want to tell us how you're going to get well for winter, if there's any skills you've got or anything that you think you can contribute to this plan, we're very open-minded. So please contact me and we'll have a conversation. Share your films. We'll look forward to hearing from you, and let's all together, here it comes, get well for winter. Right, bear with me, stop share. There we go. So that gives you, yeah, get well for winter. So theoretically, you know, it's only been going 7 days over the last week. I get about 2 and a bit days a week, but it is growing. We're getting a lot of interest. We do lots of stuff on our Facebook page, which I can send you a link to if you want later. We do all kinds of stuff. So Stuart, who was on there, was supposed to be presenting with me today because he's much more connected than me. He's in something else. We've been doing, he does stuff on hate crime. We've been doing stuff on basic healthy eating today, all of that type of stuff. We've got a Zoom group around health and well-being, which is really quite emotional. So we have people, probably slightly less, well, no, way less than this one, too. About 10, 11 people come to that. And they talk all about their kind of feelings and how they're doing during lockdown. And, you know, sometimes we just have a cup of tea meeting as well, you know, and nobody mentioned the virus at all. One of the things we were doing with this is we were aware, we were thinking sometime in November, December, second wave might come. And we thought, well, are we egging the pudding, which is a silly phrase, are we exaggerating this? Has it gone? Well, you know, lo and behold, it's all over the place. And some of our people, and I guess you will talk about this, some of the people we were doing a lot of phone supporting for, who were doing really well, they were coming up and we're meeting them in parks, going for cups of coffee. All of a sudden, all of that's gone back in the Northeast. You know, people are now feeling really hit by losing some of their friends again, especially those people who live alone, who don't have family around them. So that's what we're trying to do. It's just something, isn't it? And we're trying to get people online who are lonely and bored. And it is a Northeast and Cumbria type thing, but anybody around anywhere can click on our website. We do daft things as well. It's not all heavy. So we do pet of the week on a Saturday. So people post their pets, or, you know, we do anything goes on a Wednesday. So people post their art. And one of the guys who was just talking with, you know, he posts the first cake he cooked. Do you know what I mean? Stuff like that. So lots of fun things. I will stop in a second. But we do next Wednesday, we're also having a massive push on everybody getting, I was going to say getting the virus. No, we're not pushing that. We're having a massive push on people getting the flu jab. Yeah. So we've got original films being made by the NHS. We're going to post I think it's one every 2 days, challenging myths about the flu jabs. So we're promoting that in a big way. So all kinds of stuff. It is what it is. I mean, it's getting advertised all over the place. And sometimes I think, well, there's only us little people at the bottom of this. So we're kind of looking for more people to support us. But yeah, so that's where we're at. So that's me done.
Thank you for sharing. Does anybody have any questions? Becca.
You know, about the flu, number one about the flu jabs. There's some people that generally, like my mum, can't have anything that contains a flu vaccine because of adrenaline, and it makes her faint, and it's quite dangerous. So she can't have it in any shape or form. But then I brought it up at partnership the other day when I raised it with our manager, who runs the service where I live, the other week. She turned around and said, "Oh, I don't have anything to do with the flu jab. Oh no, I don't." And so they were actually picking that up underneath the safeguarding, that a lot of ignorance in the flu jab and that. Right. Also with the testing, what was mentioned on this a while ago, because I think there's quite a connection with them. Obviously, people like myself can't have the intrusive procedures. I walked past the testing site today when I was walking back to town from the hospital, and it sounds like the saliva test is going to be rolled out here next week. And but you can only have that if you've had symptoms or a positive test at the minute. But apparently there's a blood test you can have at the arena. But you know, when you look at that, because some tenants where I live have actually had the test with the manager coming down with it, even though we've not all been nearer, and it's come back negative. It would be good to have the blood test, but there's not information on the websites about booking it.
Yeah. I mean, I'm no expert, but that's dead interesting. We did come across a case of, you know, how on earth for somebody who was really struggling with the test, they would not be able to give blood because it was too frightening and scary. They also didn't want to have something stuck down their throat because they couldn't understand that, so that was really stressful. So I contacted some senior people in the NHS, and there's no decent reply yet. Nobody's worked out what to do about that, and it's quite.
Well, they said they've got the blood test one somewhere up at the arena, but
right.
Then it's like it don't give you this messaging on the website when you Google it.
Right. Okay. We did have one of our. I would say, yeah. I mean, I'm no expert, and that's not a cop out. I'm just running a little course. We did have somebody go and do a little film about getting a blood test, but that was take your blood. It wasn't like, well, there might have been a swab one, but it wasn't people who just refused to have them. How do we do that? You know, and it's a difficult question, which I can't answer, obviously. Yeah. Okay.
Sorry, I've heard that people who really struggle to have any type of test have been sedated to have them.
Right. Okay. That's interesting.
And that they've had, before they've done it, they've had to do a care capacity act and mental capacity act to see whether it's in the best interest. And sometimes they've even though they think that this person might have something, they've actually, just because of the trauma it will cause, they've not done it.
Mm-hmm. Absolutely, that's a decision somebody has to make, isn't it? It's really difficult. Just listening to you, I always wonder how are people sedated? How do you do that? Because I mean,
and the other thing I wanted to say is, I live in North Yorkshire, and I'm correct, and I work and I help North Yorkshire self-advocacy group connected to KeyRing. I don't know if you've heard of us.
Yeah, well, I've heard of KeyRing. Yeah.
And so we, before the lockdown, we, with Inclusion North and one other enterprise, were supposed to do a Live Well campaign to raise awareness for people with learning difficulty and autism dying, and it was going to be a big event in Harrogate. That's how I knew all the answers to your questions. That's why. That's why, and we over here, diabetes is not talked about as much. It's more epilepsy and constipation, which people seem to have problems with, especially epilepsy, because that's connected to people with autism as well, like myself. And then people who have heart problems as well, and that's connected, and it was included. And what we were going to do is we were going to have an event for a day where we invited everyone, all the health professionals from different self-advocacy groups and different organisations, and then it was going to be led by us, a small group of self-advocates, and we were going to lead the session and go around the table talking to them, and then there was going to have speakers professional speakers as well with us.
So,
but that had to be cancelled because of COVID.
yeah. So was that
But-
conference? Sorry to be rude. Carry on. I am rude. That's me. Carry on.
But we send out a pack. A pack, if you look on KeyRing and look on Twitter, for healthy eating, and also the next one we've done is human rights. And so we do, and we are pushing annual health checks at the moment as well, and flu jabs. So you can talk now. Sorry.
All that is brilliant. There is nothing that we are doing that is remarkably original at all. We're using some money we had, trying to get people that we know through the virus, basically. So all that sounds fab. I would honestly, so some of that you will have done, some of the stuff you'll see on our webpage, you'll all think, well, I've done that 6 months ago, and that's fine. We know all that. But actually some of the stuff around the flu jab, the new films will be useful. So have a look at them, see whether they're useful to you. And if there's something you want to share, something you think we've done a brilliant piece of work and it would be really good to put onto a Facebook page or to make a little film of or something like that, you know, contact me. And Rachel can send me email. I'm more than happy to nick other people's, share other people's ideas. More than happy to do that. This is too serious an issue to be prissy about our bits of work. So if you want to share something or even talk about your experience, I'm more than happy to have a conversation.
One last thing, sorry. KeyRing would love, and North Yorkshire and all the self-advocacy groups would love to work together with other organisations, because one of the things that we don't want to do is do duplicate work.
No, absolutely. That's a sorry, go on.
So if something's already been done, maybe we can, maybe I will pass on the person who runs here, the manager of KeyRing, because we're still doing it now, it's still up and running. And then we can maybe share some ideas going forward. And especially if it's videos, it might be easier, because the problem we've got at the moment is that everyone in North Yorkshire is spread over such a long place, and they've got severe learning difficulties or autism, and some people are even blind, and they don't know how to use a computer, and they haven't got carers to help them use a computer, and nobody's with them to help them use a computer. But it looks like you are still making your videos.
It's
so
sorry.
So sorry. So it may be if we could like work together and say, right, this needs to be done or that needs to be done, maybe we could like work together and then figure a way to help everybody. That makes sense.
Absolutely. And in terms of the stuff we do, you can have whatever you like. I'm not bothered about that. Go on to, so the thing with Facebook, we tend to base it around our Facebook. We do have a website, but it's mostly on Facebook, and now we've just started a Twitter thing. You've got to plow. I would look at the videos, which we're now starting to save onto YouTube. And so you've got to go through all the fluffy fun ones, which are really important for people's heads. People need to share their doggy pictures. I share my dog pictures all the time. But find the serious ones you like that'll be useful. And if you want them, you want us to send you them, put them on your own website, or vice versa. So you send me your stuff. I'm more than happy to do that. Yeah. It's a bit like, I mean, I do Easy Read with the group. I'm sure you will do Easy Read.
Oh, yeah, all the time.
Yeah, but we all nick each other's stuff. Never do a piece of Easy Read unless you Google. Find out who's done it. Do you know what I mean? Change your couple of pictures, get paid. That's how I do it. So.
No, I understand that.
All right.
Will you put some links together for me, Stephen, that I can send out to everybody afterwards so they can get to things easily? Is that all right? Go on.
I'll do some links to the actual page, but I'll do some links to some things I think you might like. So I'll do a couple of fun ones and some of the serious things. No, he's determined to fire me, isn't he? No. Yes, I'll do that. Yeah.
Thank you. And I saw a couple of other hands up. Who are? Oh, Kev, I hadn't spotted yours before. I'm not sure who was first. And I think I'm going to do your name really wrong, so forgive me. Is it Churinda? Is that how you say it? Go on, you go first. Then Amanda, and then Kev.
Alright. Hi, Ian. Nice to meet you. My question is to you is people with disabilities with a SNAP, if people can't talk, right, how would they know when the SNAP is going in? Because maybe people can't communicate or people can't do anything. How would people know when the SNAP is going in?
Right.
When they can't speak.
So I hope I got that right. And if I didn't, I apologise. You're asking me how people who can't speak and maybe not understand what's happening know when it's going to go into their flesh.
Yeah.
Well, I haven't got a clue. Let me explain my role. I'm a project worker. I'm not an NHS member of staff or a nurse. I'm like your support workers. If you have support workers, I'm that type of person. We don't know the answer to that. I mean, I think it's something that was being said earlier about questions around capacity, people's ability to understand. So that would have to be looked at. It would have to be looked at. I mean, I cannot, for the life of me, see it. It would have to be a really extraordinary situation to take somebody who doesn't understand and stick a needle in them, which is kind of being stabbed, isn't it? It's like assault. So I don't know how they get around that. You would hope that they would do a swab test if somebody could stand that and they understood what was happening, but that might be awful. And then there's the whole question of sedation. But if you're going to sedate somebody and they don't understand why you're doing it, then there's a whole load of procedures and rules to go through to make sure that that's worth the risk. Does that make sense? So, you know, if they're in a house where everybody's got coronavirus and some people have died and are all of a certain age, then they might say, for goodness sake, their life, we've got to do that. But they would have to make a really big decision about it. If they're in a kind of a village and only 2 people have had it, well, I would say, well, why are you sedating that person? You know, that it's a really difficult issue. Well, I've waffled around it. I can't answer it because each individual person would be different.
I hear some disabled people, right? They can't speak or they can't talk, right? And they don't know what's going on. Like they are in a place recognize their pictures, what's going on in their mind.
Yeah, absolutely. I get it. I'm just actually thinking and cringing at the thought of somebody who doesn't know what the hell's happening, getting a jab in them. It's unthinkable, really, isn't it? It's like you couldn't do it. So, you know.
I know there's hospital passports, which is all pictures. And if you can understand the pictures, and people sometimes who have got, they call an occupational therapist, and if they can manage to understand what the pictures are, then they communicate via pictures and explain it via pictures. That makes sense.
Absolutely.
And there's a whole chart and passport about with pictures, and then the occupational therapist has got a special chart as well to show like needles and injections and different procedures, and that they can show if the person can understand the pictures how to do it that way, if that works for them.
Thanks, Natasha. I'm quite aware of time and that we've got quite a few other bits to get through. So I know a couple of other people had their hands up before. Do you still have questions? If not, Amanda. Kev, is your question quite quick?
Yeah, basically.
Okay, Amanda.
I had the point that but when you go for your flu jab, I haven't much before, but last one a while ago, one nurse said, could see I was nervous. she said, "Oh, remember when you go for a blood test again at hospital, ask if you can have that little what makes it cold when you have a blood test." I mean, she didn't need to like tell me, but lucky enough, I must have had a friendly nurse that day, and I remember to put it in my yellow health book to remember to ask. I mean, they didn't at the doctor. They must have had a funny nurse at the surgery, but the hospital nurse asked that and suggested that ask for the cold spray.
That's a good tip, I think.
Yeah, I mean, I'll be very quick. If you can and you understand it, please get a flu jab, because from what I've been told by people who do know NHS field, they do save lives. That mean, anyway, Kevin, you were going to ask me something, and then I'll be very quick, Rachel. And then
Stephen, me and my fiance are going next Wednesday.
To get your jabs together. Excellent. That's better than the usual dates me and my wife go on. So well done you. Yeah, that sounds good. Kevin, what were you going to ask me?
Basically, I'm going to have take a blood test for detecting my diabetes levels soon anyway. So I'm going to have a flu jab on the 14th of October, and then I'm going to have check my blood levels if I've got diabetes or borderline diabetes.
Okay.
Borderline diabetes, because I don't get diabetes, I've been on.
I'll tell you what, Kevin, and I am going to apologise. I am going to have to go, not because I'm rude. Kevin, keep an eye out for. In fact, I'll send a link for it. So we've done a film today, and we've got this thing called. We nicked it off our diabetes course, and basically, it's all the things you have to do to kind of manage your diabetes. Basically, move a bit more, eat a bit better, look after your mental health.
Yeah.
See the doctors. See those people who will help you. You do those 4 things, and I'm a type 2 myself. You can control it, and you can live a long, happy life.
Okay, thanks for that.
Don't panic. Do not panic.
Okay.
All right?
Okay.
So I'm going to go, Rachel. Is that all right?
Yeah, great. Thank you for sharing.
All right.
If you send me those bits, I'll send them out to everybody.
I will do. Thanks a lot.
Thank you for coming.
Bye.
Okay. Oh, we've got Andrea back, but I can't see. Oh no, I can see Chewy. I thought I'd lost you then as well. Do you guys want to share next?
Yeah.
Yes. Sorry, I've got builders in my house and they cut the internet off, so I had to search for an iPad that I could join you again. So I'm back. I'm sorry I missed that presentation before, because I don't know if we're repeating anything that Simon just said, but anyway, yeah. So we just want to share with you an event that we did last Friday. Chewy's going to share his screen in a minute. We have a meeting called Suffolk People First, and we have it 4 times a year. So before COVID, people used to go to a big meeting room, and we'd have about 100 people with learning disabilities and their families and their carers and people from different organisations all come together, and we'd have guest speakers, and you know, it's a really, really good event. They're all planned, co-produced, and people choose the themes and topics. And in COVID, we decided that we were going to carry on with that and do it online. So we just wanted to share. This is our 2nd one in COVID. And it was all about health. So it's on Friday, and because of where we are, and because of the flu jabs, and because of the new apps and things like that. So we've got a little trailer, so we don't bore you to death with the whole, because they're 2.5 hours long, or 3 hours long the meeting was. But we don't want to scare anybody, so we just put together some highlights of what happened, and we'll be happy to talk to you afterwards if anybody's interested in asking us questions. So Chewy, do you want to share our little video?
My name's Kirsty and I'm one of the primary learning disability liaison nurses in Suffolk. So it's our job to support people with a learning disability to get the support and the help that they need from their GP surgery. So I'm going to talk to you today about your annual health check.
Hi, I'm Jerry Newman. I'm also a primary learning disabilities liaison nurse and I work in the Ipswich and coastal part of Suffolk. Thank you for having me today. What I'd like to do is to have a quick chat with you all about flu and flu vaccines. I think that's really important.
Thank you. So I also work for One Life Suffolk, but I work as part of our weight management team. My name's Laura and we cover the whole of Suffolk as well. So we have weight management groups throughout Suffolk.
This project is called Work Ready and it was a collaboration between Norfolk and Suffolk NHS Foundation Trust, which is the mental health service that covers Suffolk, Ace Anglia, my organisation, Thinklusive, and some other experts by experience. It was funded by Health Education England, which is a national NHS organisation. And it was really to create resources, so videos and easy read documents to support people with learning disability and or autism get into work or to find out about work or volunteering.
We're going to have a look at some health experience stories now and have a chance for any of you to share your own, as we know these have been very different times to live through. So during lockdown, we talked to lots of people about health experience and we filmed some stories of them. And today we're going to play 2 of the videos from Ashley and her mum, who are here today, about when she visited the hospital that Jerry mentioned earlier. So she went like mid-lockdown into hospital. So she talks about that. And this was actually shown at the Patient Experience Board for Ipswich and Colchester hospitals, which is made up of lots of senior healthcare professionals and doctors. And they were really grateful for you guys for sharing your experience. So now I think we wanted to have a little time for your own health experience during COVID. So it might have been that you had to go to the hospital or the doctors, or maybe you couldn't get something that you wanted to, or even the dentist and things like that. So does anyone have anything they'd like to talk about health related?
Charlie, you've got something to say.
I had a blood test. It was not nice.
What were the staff like?
Excellent.
Did they wear masks?
They wear masks.
What did you have to do?
Wear masks.
Yeah.
Did you go to the doctors or did you go somewhere else?
I went somewhere else.
Yeah. You want to tell them where you went?
I went to the Churchill.
Was it all right in there?
Yeah, it was all right in there.
Yeah. And what's good about getting a blood test?
Keep me healthy.
Yeah, and they can find out lots of stuff, can't they? So it's not the nicest of things, but it's a good thing to do, and well done.
So mental health has been quite interesting because I went through a time when I was going on a phone call with the mental health team, and apparently they only did things with COVID. So when it came to me doing stuff from my own experiences of life and what's been going on, things hadn't been easy when you go through tasks, because if you're doing tasks over the phone, it's not easy. So they said, okay, we'll put you on to a face-to-face one. I'm not able to go on to a face-to-face one, even if it's online.
I had so much things I'd planned, and then it all fall in place because we couldn't go out and do things.
That's right. Yeah.
Well, that's why I will share my experience, what everybody else is saying on there earlier.
Yeah, thanks, Patrick.
One more thing now.
There's a new app out that's called the COVID-19 NHS app, which Max started to put together into an easy read document. You can see the pages here.
We're gonna wrap up because we said we'd finish at 12:30 and we're going to. It's a real sort of amazing thing that we've taken Suffolk People First, and the people who attend Suffolk People First normally are coming on now, and that's helped. Yeah, thanks to the staff and the providers for getting everyone else on.
Right, so one of the great things that happened this time was that we worked with, so in Suffolk, people are going back to day services, you know, they can only choose one, but they can have some kind of day service. And we worked with the people in those services to get groups of people to be able to take part, because they'd normally come all together. So they really worked hard. The staff really worked hard to get a big screen up and come to the meetings. So I think and also Rachel sent the invite out. We had people joining us from different places in the country as well, and that was really, you know, really good. It felt a really good meeting. So those are just quickly put together highlights of what kind of happened, and if anybody wants to ask us any questions, we'd be happy to answer them. Yep.
Becca, then Amanda.
Yeah, in Sheffield, so some of the day services have gone back a phased return, like Mencap and that, with reduced numbers of people. But then you've got services like Grange Crescent that nobody's heard anything of, even in the day, where external groups use them at night. So all that sort of stuff's gone quiet. I don't know if it's every areas that are getting certain day services back and others at later dates, or.
Yeah, I only know about Suffolk, and I think people can choose 2 now, can't they, Chewy?
Yeah.
They can choose 2 and go on different days, and it's less people and everything's spaced out, but it's nowhere near back to normal for people.
Somebody on a walk recently, and he was with his carer. He says, I usually go to Grange Crescent in day, and they've not even let us know anything. And I says, well, no idea.
There was a lot of that, Becca, a lot of people not being communicated to, but it slowly in Suffolk, the information is getting to people. But we had to highlight that as an advocacy organisation to some of those providers, that people weren't getting the information.
Thank you.
Amanda?
How did you?
Sorry, Amandas.
Sorry, Amanda.
I have 2 Amandas.
Sorry, it's 2 Amanda, but I had my hand up, Amanda.
So I see.
Yeah, okay.
I didn't say which.
So maybe if you put your hand up, Rachel will come to you in a minute.
No.
Mine was just very quickly, because I know you've done some really good easy read information in the past, and you said about the easy read information on the COVID app that you can download. I wondered if that is available on your website, and also have you done something about flu jabs as well?
We're doing, the COVID stuff, because it only came out the day before our conference and Max started it, so that should be with us this week, the full document, and that will be on the Ordinary Lives website, Amanda.
Okay, brilliant.
I think you've been on that, haven't you?
Yeah,
and
yeah.
that'll be there as soon as we've had it, and we'll tweet it out and share it with everybody. The flu jab stuff, we've got again a big campaign and lots and lots of stuff. So if you want to contact me after this meeting, I can share with you loads of things. Have you got my email address?
I think I have, but I'm not totally sure, but I will, because I think it came out. I might have to have trawl back through all the things, the previous ones of this.
I can connect you up if it's quicker.
Okay, thank you, Rachel. Okay.
Yeah, okay, and then I can show you, and you can choose, well, you can pick if any of it's any good for you. Yeah.
Okay, brilliant, and we'll make sure we credit you, okay?
Yeah, thank you.
Okay.
Thank you.
Was there any more questions? I'm aware that we've got 10 minutes left, and there was 2 things left still on the agenda. So if it can be sent directly to Andrea and Chewy, can we do that so we can move on to the next bit? Is that all right? Or if you stick it in the chat, then Andrea and Chewy might answer in there.
Yeah.
If we go to Marsh next, could you tell us about? Sorry, Andrea.
I can't do anything in chat, so Chewy, you'll have to.
Yeah.
'Cause I don't know how to work chat in an iPad. I just, yeah. Okay.
Marsh?
Me next. Okay, I'll be quick with my one because it's something that hasn't happened yet. It's something that's coming up. So it's not something that we're organising. We're being part of it, and it's called the Big Health Week, and it's for everyone in 3 boroughs in Lewisham. So it's Greenwich, Lewisham, and Bexley, which are sort of 3 areas that are next to each other. Bit similar to the Suffolk People First thing. Last year it was a big health day, and it was a thing that people went to. I think they had about 340 people came to it, which was quite impressive. It was quite a good big thing that went on. So this year the NHS have decided in our area they want to do it online. So they have set themselves a big target, which we're happy to help them with. So they're doing 5 days, 6 sessions every day. So it's quite a lot of stuff for people to choose from. There's exercise slots every day where people can tune in. There are cooking sessions every day that people can watch and cook along with. And then there are more serious things like about cancer screening, some of the stuff that people have mentioned about flu jabs, looking after your weight, like all the things that you've already talked about, lots of different things like that. So we're helping them out. We're doing 1 session every day on a different subject, a bit more serious, like hate crime, advocacy, rights to healthcare and stuff like that. So we're taking part in that. The big thing that we had a bit of a conversation with, I'll put it that way, was that they wanted to do it all on some weird webinar platform. And we kept saying to them, you need to do it on Zoom. And they were, oh, we can't use Zoom. We can't use Zoom. With the NHS is not allowed to use Zoom. And we kept saying, if you don't use Zoom, people are not going to join up to it. And I think it was at the end of last week or this week, they finally gave in and said, okay, well, you can have it on Zoom. And then they asked us if we'd host it all, and we went, no, we can't do 29 sessions in a week. You know, we've got other work to do. So still a few issues to come, but it's quite a nice thing to be involved in, quite exciting. It'll be interesting to see how many people actually join across the week. I'll be impressed if anyone goes to all 29 sessions, which is a bit unlikely, but yeah, that's it really. Just wanted to tell you about that. I can come, you know, if we're still doing these meetings, I can tell you how it went and whether it was successful once we've had it. It's in the first week of November, and it even includes an online fireworks display.
Wow.
So I'll leave it there because I know Rachel's got something else and we haven't got long.
Marsh, if anyone's got any questions, do you guys want to stick it in the chat so we can make sure we get on to do everything else? Kim, sorry,
Yes.
you've not got very long left.
It's okay, it won't take long. So obviously annual health checks are really, really important. Lots of work being done around leader and things like that. We've had experience in North Yorkshire of somebody being offered an annual health check via a paper form that they fill in. And I just wondered if anybody else, if annual health checks are going on in your areas, if they're being carried out face-to-face over Zoom, if they've been cancelled. I understand that some have been delayed, which, you know, makes sense to me, but my concern is that actually if they continue to delay them and if they're offered on a paper form, things are going to get missed. With learning disabilities are already at a disadvantage and this is going to disadvantage them further. So I just wondered if anybody has any experience of that. If it's easy for everybody, you can share my email address, Rachel, and just let me know. It's just so that we can kind of try and improve things for people, I think.
Amanda.
We just had like that appointment and then a form, fill in, you know, how you have been, and then send it, being told to send it to the surgery before you check. But this year other times you get to see the nurse and doctor, but this year we only had a phone. Our doctor phoned us on that specific day after she saw the form. That's all we had this year. And Kimberly, I used to be, us in Boscombe and Bournemouth used to be under KeyRing, but not anymore. We beat KeyRing, but we're under the local authority.
Right.
We still kept the people, the staff were still there when we still have the same staff from that KeyRing time.
Good.
Has anyone else got any annual health check experiences they would like to share? Kev?
I'm still waiting for my annual health check. It's delayed, I think. I have to ring them up again and chase it up. I had it last year, but I'm still waiting for it. Yeah.
And do you know if that'll be face-to-face or over the phone?
I think it's face-to-face, what I did last year.
Yeah.
Thanks, Kev. Amanda?
Oh, no.
Sorry, I'll be very quick. I mean, we have got a new clinical commissioning lead on learning disabilities, and I did raise it with her. I had a chat because we had a health action group the other day, and I am really concerned, like you, Kimberly, that the inequalities in health and people just doing a phone call with people, how are you going to check somebody's health? So
Yeah.
it is a real concern for me personally, I think.
Yeah. I mean, is there potential for a campaign somewhere? Not that I'm creating more work for everybody, but I just think prior to lockdown, things were bad enough, and lockdown is going to add to that, and things are going to get, or potentially could get much worse, and it's not acceptable, really. Yeah.
Rachel, can I just come in and talk about the project that we're doing? Yeah. So NHS England gave a few organisations some money last year. What we were meant to do, Kimberly, was to go around the country to different areas and talk to self-advocacy groups, and it was all about annual health checks. The flu campaign's been added to that. So Learning Disability England put Ace in touch with 7 different groups in the area. I know Marsh, Lewisham, one of those groups, and different in different areas. And we're doing some online workshops with because we were going to do it in real life, and then people were going to go out there and do it, but obviously that didn't happen. So we've very quickly made it all into an online thing, and we're working with individual groups to personalize them because it's not the same everywhere. You're right, it isn't the same everywhere, and we're just trying to get that information that people have already got. Now, even though I'm working with all those groups, if you want to email me, I'd be happy to share some of the stuff we're doing, and it might help you, just go and do it. With the groups we're working with, there's been a small amount of money that NHS England have given, but the resource is there, so I don't see why we can't share it wider than we can if we've already got it. So I'd be happy to talk to you.
That'd be lovely, thank you.
Yeah, if you do that, because there's loads of stuff to look at, and you could, it's all, a lot of it's editable, so you could just put your own name on it, and if you can do it, you can just go out. Yeah, does that help?
Yeah, that's lovely, thank you very much.
Yeah.
We're at 4 o'clock. Has anybody got any last things that they would like to add? Or has anybody got any topics that they think we should talk about next time? Because we've managed to fill today really quickly with all the health stuff.
Rachel, I'd like to I put in the chat that on the 16th of October, I'm doing a disability meeting on Zoom, so anyone is welcome to join.
Okay. I'll maybe grab some more information from you and we can share it in the email that I sent to everyone after this.
Yeah.
Is that okay?
Yeah.
Cool. Becca?
Yeah, one of the things I remember you saying last time, that if there's a blanket protection around supported living or care homes, you wanted to know, and I did email you about it.
You did, yes. I know that I owe you an email, Becca.
Yeah.
Thank you for reminding me. I'll do that after this. Marsh, did you have your hand up?
Yeah, just an idea. I was going to ask if anyone else is doing anything on the Law Commission are doing a consultation at the moment on hate crime and making disability a bit more equal to some of the other groups. And they're asking lots of questions around by December, I think it's, there's no rush, but we could do a session on that one time maybe if we're going to carry on these sessions. It might be interesting to see what people have got to say.
Great, thank you. Would you send me a link to the general information for that?
I will do, yeah.
Thank you. Any more for any more? Nope. Great. Well, thank you very much for coming, everybody. We're only a couple of minutes over and we've managed to squeeze it all in. I think we did really well to get it all in. I wasn't sure we were going to. But yeah, thank you very much for joining. And I will make a bit of an email list up of everything that we've talked about today and connecting the people who I said I would connect. If you don't hear from me within the next couple of days about that, please remind me, but I will try and get everyone connected. Okay. And then the next meeting is in 2 weeks' time on the 15th. So I will send some more information around about that as well.
I think